Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hi, everybody. Welcome to this week's edition of The Holistic Nurse. I'm Peggy Smith, and we're going to be talking about healthcare and beyond the bedside, how Holistic Nurse is transforming healthcare. And with me today, joining me is Dr. Gloria Warren. She has lots to offer on this topic, both as a professional and a living it with family members who the challenges healthcare presents. Does healthcare feel like it's just too intimidating because of all the technology? Does it feel like sometimes your nurses and even the doctors don't have time for compassion because they're so absorbed and intimidated by that same technology that scares you? What does the future of nursing look like? Well, about the only question I'm probably not going to be able to answer is what does the future of nursing look like? But we will be addressing these topics, and Dr. Gloria Warren has lots to offer on this. Uh, Today's healthcare system is changing so quickly. And to be fair, although it's frustrating for the patients, most of the really true devoted health professionals are also very frustrated and somewhat intimidated. Um, we have the artificial intelligence is everywhere, making you feel sometimes that, you're not too bright yourself. You thought you were a highly intelligent person and you can't keep up with artificial intelligence. Um, Wearable devices can monitor our health around the clock, but then as we're using them, sometimes it really increases the stresses that we're dealing with. Um, I've never recommended acting like an ostrich and burying your head in the sand. You do need to know what your stats are and what you can do to improve your health. And when we don't have access to the healthcare like we used to, you used to have the doctor that delivered you in your mother's bed and followed you all the way through to college sometimes and more, and delivered your kids. Um, those were the good old days, but there were a lot of accidents and things that, we have better control over now. We do have better outcomes, uh, but the process sometimes to get to those outcomes can really be improved. But I think, Gloria, one of the most exciting things about the challenges we're facing with this is that we actually are in the driver's seat to a larger extent than we used to be, don't you think? You
Oh,
know, we
absolutely.
uh,
Absolutely.
you usually type
Go
1 diabetics sometimes didn't know they were out of control until they had, needed dialysis and needed, all of the devices they have
mhm.
now. I think it makes it much easier. So holistic nursing, as I've told you before, is it just means looking at all of us and all of our lives and every part of our lives as a whole entity. It the traditional term most people right away think of alternative methods, complementary medicine, acupuncture, herbs, massage therapy, all of those things. They are part of holistic, but they address symptoms that we have control over when we're trying to improve our lives. Um, in medical schools now, they're calling, I guess, aspects of traditional or holistic nursing integrative medicine, uh, which basically incorporates the whole person. They're actually learning how to listen to people. Um, and many of these new young doctors, remember, grew up during the COVID era where they didn't have a lot of access to people before they got to college. So it's not that your doctor sometimes is standoffish and is not listening to you. He's really trying to do the best he can and understand all these new tools himself, just like we struggle with it. Um, what do you think about, with you having family members, Gloria, that, have challenges, and do you find it's harder to get care for your mother? Um,
Actually, getting care is much harder. Um, at the state I'm in, every state is different, but it's just utterly ridiculous. A few years ago, my pops, he was dying for over 6 months. He couldn't get out of bed. I could not get one nurse unless he was on an IV. They wouldn't send a nurse. It was just horrible, absolutely horrible. Now, like my mom, she does have a few state nurses that come in every now and then, but it's so limited, completely limited. I'm around the clock, and it's like 3 times a week I can get somebody to come in to check on her and do their thing a bit to give me a little respite. But I mean, respite seems to be the biggest problem for home caregivers, I feel. AI, it is good in a lot of ways. There's good and bad with everything. And you don't have the privacy that you would normally have under the HIPAA rules and regulations. It is good because I can check her blood tests if it's one of the diagnostic machines like a glucometer of sorts. They're not as accurate. There is a very wide margin of error with those type of machines. So you always need to be prepared to check blood sugar manually by yourself using a separate glucometer because the arm ones they're still working on it. So I'm seeing in the future a big improvement on that. That would be wonderful. And I can, oh, I don't want to get into how I know, but I worked in the field many years. So there
Well,
are
one
some
thing,
errors, wide errors
uh,
there. But you just need to have a backup plan as well. Like if you're getting high numbers off of your uh, arm glucometer, I'm just going to say, I don't want to say name brands. So if you're doing that, you just need to make sure don't throw away your little handheld where you poke your finger a bit because you need to double check that sometimes. But a lot of things, and too with healthcare where it's moving, like you're saying, holistic nursing, complementary medicine is always good. As an epidemiologist, I know for a fact that if there's epidemics, the medical system is overburdened and complementary medicine practitioners are going to be called on. The public are going to need them even more so. So it's all around. They're going to need medical attention and various types of medical attention as well. So that's where I see the future going. More of a mix and match of different types of healthcare for you to choose from.
well, one thing I've learned in my home care experiences, and when I do home care, I'm usually in home infusion type settings, but uh, I don't just go in and say, this is how you're going to do your IV at home. I'm
Yeah,
going over all the medications. I'm looking at the family dynamics to see if, especially if my patient doesn't look like they could manage it themselves. And I have very, very rarely in 45 years of home care found a family that actually calibrates those home glucose machines. When you get them, they have the little drops, which do
hmm,
expire. Those expiration dates are important. The expiration dates on your strips uh, are not accurate once they've expired. It's not just to get you to go buy more, because that is the most expensive part of that device, those strips. But it would give you inaccurate results. When you're in a hospital or a long-term care facility, every single 24 hours, those machines are calibrated, usually by the night nurse, to make sure that the numbers coincide, that nothing's expired, that nurses are using. And even though the book tells you when you buy one for your home, um, it nobody reads the directions. I get very frustrated myself if I buy something that I have to actually put together, you know.
right.
And and I'm in this younger generation, not to call out our age, but when I'm struggling to find something, I forget I can look on YouTube. I had a brand new home infusion machine. I was training a new nurse, and I said, "Would you like me to print out this manual for you?" She said, "No, that's okay. I'll just look on YouTube." And I was used to my husband looking on YouTube to see how to fix parts of the car or plumbing or something. I didn't, uh,
Very common nowadays. Yeah,
but it
yeah.
is important to know what your sources are, and everything on YouTube is not always accurate.
For
Excuse me, everything. All practitioners are not equal.
Correct. You know, I got to hand it to holistic nurses though, because I remember nurse practitioners even, they would come in and what are you here for? You know, I know like Walgreens and all these places had these little mini clinics. And you would go in there, oh, I got a really bad sore throat. So they check your sore throat and everything else. But nowadays, with a holistic nurse, this is the big like expansion of healthcare, I feel, in the last few years, especially. Uh, Now, a holistic nurse looks at things in a holistic formation. In other words, the whole person. You hear, okay, sore throat, and then they'll be talking to you and they'll be like, are you under a lot of stress lately? How's it going at home? How's it? They're checking your mental health, your stress levels, your emotional well-being, and looking to see, do you have the support systems or is your immunity dropping too low because of stress, and environmental influences, they look at many different things happening in the patient's life. And kudos to all holistic nurses. I'm so grateful for them because they're not just, oh no, this is the reason why you came here, so this is all we're going to look at. And you get that a lot now in the medical community. I've noticed it. I've seen it with people, and it's really sad because if you have, let's say you come in with a broken bone in your hand and you're at the hospital because you're running a high temperature because you have an upper respiratory infection, and you mention the broken bone. Oh no, I'm sorry, but that's not why you're here. And it's like, what? you
And
know?
that's one of the challenges in traditional care because insurance companies are programmed to be as efficient as they can per each diagnosis. That's why we have all those, codes that, you
Oh,
know, and, especially if, with the autoimmune disorders, you never have just one. And every once in a while,
mhm.
rarely, hopefully, but all of your immune disorders could actually flare up at once. And,
Yeah.
and nobody's listening to you. They think you're a chronic complainer. Um,
Mhm.
but one of the earliest, most common in recent year type decades, I guess, were the chiropractors. And I remember growing up, oh, don't go to a
Yeah.
chiropractor. That's a quack doctor. He's not a real doctor. Well, and you
Yeah.
also associate them with, strained backs, knee pain, or, usually it's back strain we're going to chiropractors for. Chiropractors, though, are trained very holistically, cover all. Like I went, I think, for an orthopedic problem years ago. My 10-year-old had a bedwetting problem, and he said, well, what's going on in what's going on in your life? Most regular doctors rarely have time to ask that question. Um, and they get reimbursed less if they're asking questions that are unassociated with the diagnosis that you went to see them for, which is really sad. I don't know
Mhm.
how we're going to fix that if we ever can, except just learn to
Holistic
be
nurses.
the holistic nurses help. I get patients complaining, well, I wanted to see my doctor today and they gave me the nurse practitioner. Why doesn't the doctor want to see me? And I said, you need to be grateful that you got the nurse practitioner because she's going to listen to you. And if there's something that's out of her scope of practice, believe me, the doctor will know, but she's able to handle a lot of things that your doctor's not allowed to handle anymore, as crazy as that sounds. We're going to take a brief break right here, and we will be back to continue this discussion because it's one that we need to talk about more often, I think. Be right back.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to easysense.com and learn how, with your help, we can fight these horrific brain disorders. That's easysense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Hi, welcome back. Dr. Gloria Warren and I are discussing holistic healthcare and the role that holistic nursing helps try to sort that and simplify the challenges of healthcare. Healthcare holistically a holistic nurse is able to call your regular practitioner, especially if they're in a professional role. But I had a man just a couple weeks ago. He had collapsed out in the public, ended up in the ER with 1,000 blood sugar. He never knew he was a diabetic before. He knew his grandpa had it, but didn't remember what he died of even. And it turns out when they discharged him on like 3 different insulins, and I said to the wife, well, how are you checking your sugar? She said, we're not. They didn't even tell us how to give the insulin. Do I give them all at one time? What? No, you don't. They talk to you about it. And no, that's not an uncommon situation. They discharged him. They were going to put him in rehab for a week to get more of that education. But the manager from the floor they were going to go to came down and said, we don't have any nurses. Our staffing is so bad. We had beds, but no nurses to take care of them. And she kind of blamed it on the nurses. Well, the nurses are really being uncooperative and bitchy about being overstaffed and working conditions. That's fine. That's a reality. I understand that. I've been there, but it's not something you want to send the families home with that message. But because everybody is so stressed, and it's to the point, I think, Gloria, where the professionals aren't setting good examples at taking care of themselves. Even the best ones are just trying to help everybody, and we can't. It's kind of like when I'm rescuing animals, I have to accept the fact that I can't save all the pit bulls in the world, as much as I'd like to. But people, we do work hard to, despite lack of support from higher ups. And, it's not even the middle managers. It really is the insurance companies, the stakeholders of the hospitals. They're the ones that's driving.
Yeah. And then compassion actually takes a back seat because they don't have the time. I think you were talking to me about the time that they can spend with a patient nowadays. It's so different. Even though I remember a time, because I worked with specialists, and they only took 5 minutes each patient, and they were in and out, but they were so succinct and direct, and they knew where they were going with it, but they send us in first, and we would have a chance to talk with the patient and figure out what are we targeting today. So when that physician came in, they knew. But now without nurses or people like me, they don't have that target, and they go in there and they're kind of baffled sometimes because they were just in with John and Jim and Joe, and they all each had different separate situations, and then they come in here blindly, not really knowing, which maybe they didn't have the time to take a look at the chart, and then they're thrown in. And it's kind of like, come on, quick, quick, quick. The insurance needs you to take care of me fast because otherwise they won't pay, type of thing. But the patient doesn't see this picture. They only see that time spent with them. So the compassion has been minimized for the most part. It's just sad.
And I think well, yes, the patient as the recipient of this healthcare does feel like there is no compassion, it's less. But if you look at everything through the filter that we talk about, gratitude and just controlling your things you do to control your stress. It's kind of like road rage. There's a lot of bad things happen with car accidents and people, and sometimes people lose their lives over something like that. Well, you're kind of feeling a miniature version of road rage when you feel like you're not getting what you feel like you're paying for. And yes, even if your insurance covers 100%, you earn that insurance, or you're paying for that insurance on some level, whether it's your taxes or wherever it came from, Medicare. Um, but because we know the reality is, and it's not just AI, it's the stakeholders and the private equities
Hmm.
that so much of healthcare, the lack of the opportunity. You don't have the mom and pop pharmacies anymore. Sometimes you
Right.
didn't want to ask your doctor questions because you felt stupid, and you should never feel stupid. There are no dumb questions. But you knew when you went to fill the prescription, the mom and pop pharmacist would explain everything, and he would know your whole family's history and make suggestions. Uh, if he knew
Hmm.
that you were a heavy drinker, well, Joe, you probably shouldn't be drinking when you're on this medicine. Could have some bad things happen.
Right.
Um, and we don't have that
Mhm.
anymore.
That human connection. Yeah.
The human connection is never going to go away, and I know they're trying to make a lot of AIs more human. I think I was just typing something general with AI, and I got, I'm sorry you're going through all this stress, and I'm looking at my computer like, do we stick to the task here? Like, you, you
Hmm.
know, it's weird, and it's scary, kind of like, okay, where's Big Brother? Are you in my computer now too? Do I have to turn off my computer every time I
Yeah.
walk away? Um, Even the home devices. I won't name it by name because then they'll start talking to me as I'm here on the show. But there's three major ones. You can't say their
Yeah.
name, or they're often saying, "Well,
Hmm.
I can help you with that." And I wasn't talking to you. It's okay.
Right.
But that's intimidating for people. They can be very helpful.
Yeah.
Keeping you tasked, keeping your schedule, reminding walk the dog before he has an accident, things like that. But it does feel like you have less control in your life. And I think holistic
Hmm.
nurses and practitioners, we try to teach you how you can keep the control that's you need to have. Um, so there's just one of the things we've talked in, one size doesn't fit everybody. One practitioner is not the right one. I mentioned the chiropractors because that same visit that they did something for my 10-year-old with a bedwetting, and that's not why I came there. I coughed or something, and the chiropractor said, "Are you getting sick?" And I said, "No, I have a sore throat, but I have allergies." How you make the excuse. He took my
Hmm.
hand and pressed on, the pressure points there. My sore throat disappeared instantly.
Oh my
And
goodness. That's
I didn't
fantastic.
know how extensive chiropractors, what their training is like. And they were probably
Yeah.
the original, you know, uh,
Back in the 70s and 80s, I remember going to a chiropractor and, they just, okay, lay on the table and crack, 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 after they took x-rays, of course. But nowadays, they've combined what they've learned from complementary medicine practitioners. Um, and now they'll, put heat on your back muscles. They'll have somebody loosen up the muscles and everything so that when they straighten up that spine, they're not tearing muscles and things like that. Where I think before they got a bad rap, but they got a bad rap because they weren't as expansive as they are now. Nowadays, though, with their expansive knowledge, they've really tuned in on everything they need to do for the patient to make everything flow and be,
in case
better.
people don't realize, chiropractors are not all the crack the bones anymore. They have a
Right.
neurostimulator, a little device that tap, tap,
Yeah.
tap. And they know exactly, and that's so much
And where did
nicer
they
than
get that idea from?
that came
The
from energy
holistic.
medicine.
Yeah,
Yes. Um,
exactly.
and one of the dangers, and I think it's still something to be aware of, if you have a chiropractor, it's very rare you're going to find one of ones that were not holistically trained. But most of them now know if that they need X-rays or further tests. They know how to identify, because just like when I took a yoga instructor's class, yoga, I was shocked. They knew anatomy better than I'd learned in nursing school, because as practitioners and helping people in the different positions, you don't want to cause
Mhm.
injury. So, holistic people are very dedicated. They are always increasing their knowledge and the courses, and A lot of times the doctors only barely have time to do the CEUs and stuff that are required to keep up their degree, their license.
Right.
Uh, so these wearable and individual devices. What would you say to somebody with no medical knowledge, but now they're watching these things, and how do you know when to ask your doctor? I guess if you get alerts on your phone that something's wrong. And I love it when my iPhone tells me I'm stressed and I didn't sleep well. Like, where were you in the bedroom? Um,
Yeah. Yeah. What I'm seeing is that physicians are using, not all physicians, of course, the ones that I know of, that the people that have spoken with me recently. I'll give you an example. Somebody wears an electronic device on their arm and it tells them their blood sugar. And she went to the internal medicine practitioner and he says, "Oh, your A1C is 7.8." And she says, "Well, no, my blood test says 5.4. "Yeah, but your device says it's 7.8. And she says, "Yeah, but my blood tests say 7.4. And he goes, "Oh, we go by the device." And that was it. That was it. It's like, wait a minute here. They need to train the doctors when they talk to them about these devices. The companies need to have the doctors better trained. The margin of error is quite vast. It can be anywhere from 90 and down to only like 65% accuracy. I mean, there's a huge, vast margin they're dealing with. And it all depends on the machine, of course. Each machine is not perfectly calibrated because it's a device that goes through transport and gets knocked around and everything else. And, there's a lot of different factors. But the physicians need to realize, if I had a choice between a device for an A1C and lab results, I would choose the lab results any day of the week because they're
well,
more accurate.
if you're having any results at home from any of these home devices that are
Mm-hmm.
concerning, your doctor should always follow up with the traditional lab work. And something people don't realize, those the diabetic sensors, depending on where you place it on your body, and you do have to rotate sites and things. If you have
Mm,
more flab in certain arms, or different parts of some people put it, different it's going to register differently based on the capillary bloods that's available for understanding.
beautiful, perfect comment. That's
Yeah,
exactly where it's at. Less
yeah.
blood flow, it's not going to register as quickly, and it may not register as accurately for that exact moment in time.
And even though we're talking capillary blood flow, our harping on hydration generally, it's not just for your venous blood, it's for all your blood. It's for your
Yeah,
oxygen, because the blood transports oxygen. So if you're not drinking enough, blood really is a key part of our body. Sometimes when I'm trying to get labs at home for somebody and I'm not getting blood right away, and they'll say, "Well, what does that mean?" In a panic, I said, "It means you get a discount when you get to the undertaker. He has less to embalm."
a
You
discount.
got to keep it simple.
Okay, low blood volume. Yeah, yeah.
But there's Gloria, talk about what exercise can do. Even that's something. It's something we don't have to spend money to exercise. Even at home,
Yeah,
you don't
that's
have
the
to go to
best,
the gym.
number one thing anybody can do for their health is exercise. I was an advanced healthcare advisor for health clubs. And one of the things, the main thing everybody can do is start exercising. By exercising, you increase blood flow, you minimize the bacteria in your body, you help your lymph nodes clear out so that it can handle viruses when your body's being attacked. Even chemicals can clear out faster because, you have excretory excretion of chemicals from sweat. To me, that's the number one. Sweat really is non-prejudice for what type of environmental exposure you've been exposed to. Sweat helps
Okay,
everything get
we're going to
released.
come back and after for another break. We'll see you in a few minutes. Thank you.
Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like, it was almost instant. Like, I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
I welcome back to the Holistic Nurse with Peggy Smith and Dr. Gloria Warren as we're expanding on what the role of the holistic nurse actually is and other practitioners, not just nurses. Gloria, you were saying at the break you wanted to mention something here?
Just to keep in mind, there are a lot of downfalls with AI, but there's also positives with it. And some doctors choose to use it. I know a doctor that doesn't use AI or even a computer with their files. It's all paper still. A lot of compassion in that office. So let me tell you, it's wonderful. But on the other token, it can help to AI in general or technology administrative burdens. It helps relieve some of that. It helps document times and things of that nature. Data entry tasks can be bypassed in some instances at some certain points of a patient's file. Workflow inefficiencies can be actually helped too. Now that goes both ways. It depends on the office that you're going to, but it allows nurses more opportunities to focus on the patients. What I'm personally seeing though is that it's actually taking the nurses out, and the CNAs, the nursing assistants, are doing more talks with the patients. But it all depends on the facility. It can identify patterns though of early disease detection, medication management, risk prediction, resource allocation. Those are things that technology can't replace empathy, but it can replace those things or assist those things to coming to fruition. The future, though, of healthcare requires a balance of technological innovation along with human-centered care and compassion.
Well, and I think we did a show on AI, I think a couple weeks ago, and I brought out that nobody reads those. This is not a bill, but I just as a learning experience to me, I gave it to AI. He identified. I don't know why I call it a he, but that bothers me too. But AI identified, billing errors that because we weren't going to have to write a check for those errors. It was an insurance issue. But we wouldn't have known that, and it's maybe one of the reasons we're running out of money for healthcare. But it also noticed that, at this facility, this patient was on these meds, went right to this next facility, and you're not on the same meds. Did somebody forget something? And I wouldn't have noticed that. I wasn't looking, I was focused on the actual billing errors at the time. And, they were able to point out the whole pattern of care programs for care plans and things were not the same. And, you had this diagnosis at this facility, but now he's not even a diabetic anymore, just the next day after he transferred. Things like that. So, if you stop to even listen and not panic right away when there's things you don't understand. When you were talking about exercise, those drugs for osteoporosis have a lot of side effects. if that's the only way you can build your bones, you need them, and you might have to try a couple that are most compatible with your body. But actually, there's all kinds of literature out there that the best way to build your bones is exercise, especially
Heavy
for older
lift,
women.
heavy weights,
Also,
lifting.
with
Hmm.
if you have such a big bone loss when your hormones drop in menopause, exercise is the best way. And sometimes it's enough to avoid some of those toxic medicines. And it's like you need chemotherapy when you have cancer, but there's always side effects. All
Yep,
medications have side effects. So uh, holistic nurse is never going to say forget your doctor and don't take the medicine. If you need it, you need to take it, but you need to understand what you can do maybe so that you need less medicine.
right,
Blood pressure medicines are a common one people have a lot of side effects with, especially until the body gets used to them. But if you're doing some of the other things we've talked about, controlling your stress, getting enough sleep, changing your diet so there's less salt and, the right balance of fluid and everything, you might need less medicine and there's less side effects. Um,
right. Just remember, if you're listening to the show, please check with your practitioner, your healthcare practitioner of your choice, and make sure this is what you decide to do. But yes, no two patients are exactly alike, so nobody can say something direct to you without you getting something slightly different from somebody else telling you. So keep that in mind. And
and one of the common things I hear in home care is, oh my gosh, I'm on that drug now. Oh, Aunt Mary had that and she had a horrible life and all kinds of complications. You're not
mm,
Aunt Mary, and you don't know what else Aunt Mary was doing.
right,
You don't have the total picture. Um, so it's important, I think. One of the things we recommended on a previous show, you should have either on your phone or on your refrigerators, where they did it before we had all these smartphones, uh, a list in case there was a 911 call and the paramedics needed to get information quickly with your allergies, your medical history. Um, if you've got a pacemaker, they should know that. Different things like that. That's when AI really helps organize things for you. It used to be a big chore. Oh, I know I need to have this medical list, but it's 10 pages long. It doesn't have to be. AI can do it really simple for you. Um, and you should know, I think we mentioned it with these devices. Well, one of the things home care nurses are doing now, and it's using AI, it's using these external devices to monitor, uh, and you feel like maybe Big Brother's in your house checking your blood pressure and your scale every day. But what's actually happening, AI is identifying the patterns and will know if you gain 2 or 3 pounds and and you need a different diuretic or something changed in your life. And the doctor gets notified immediately. Somebody's on the other end of those devices, even though they're remote in
mm,
your house. And like when you have a pacemaker, you have that monitor that knows,
yeah, that's a wonderful system.
so there's a
All
lot
goes
of,
through this one hub in the U.S. and it's fantastic. They get notified if something's really out of whack. But on the other hand, though, if you're noticing something, please call because sometimes it won't pick up everything, which it's just the way it is when you deal with Wi-Fi and whatnot. But they're wonderful. Yeah.
so there is a new device for you. Usually you can't get that sensor for diabetes unless you're already on insulin. I'm not sure about the Android devices, but Apple finally got FDA approval for a device that checks blood sugar basically with the lens in your camera. Um, and I wouldn't take that as a reason not to do those AccuChecks anymore. But if you're getting several results that seem questionable, you want to talk to the practitioner and make sure that you have accurate information. Because again, everybody, is not even going to be as sensitive to the way these devices were calibrated. Um, there's, there's so much. But if you're worried about not getting enough human connection, and you have limited time with your doctor, when the calendar says next week you have to see the doctor, start writing down all your questions. Don't wait till you get there,
Oh,
and you plan an
yeah.
agenda for doctor's visits. The doctors appreciate it. Important things won't be missed. Um, it's there's just so much we can do, and it's okay to tell your doctor that you've been reading Dr. Google or AI
Mhm.
ideas, but make sure you run by what you're doing, because many herbs do are contradicted with prescription drugs. Many prescription drugs have some of those herbs already, and the mix might be too much for you. So that's why we have to have open communication. And it's your responsibility to tell the doctor. He is not or nurse. He's not a mind reader.
Yeah.
I found, well, I called my doctor and left a message. He didn't answer. If there's something you really need to know, it's good to ask for the doctor's nurse, and she'll make sure that she'll know if it's a problem right away, or she'll make sure the doctor will be able to address.
Right. And in today, holistically, modern lifestyles often um, keep people locked in chronic sympathetic activation. Sympathetic nervous system, just as a quick review from one of the past shows, sympathetic nervous system prepares the body for action. Parasympathetic nervous system promotes recovery, repair, digestion, and restoration. So how does this relate to what we're discussing today? Well, the vagus nerves plays an essential role in helping regulate the body's relaxation response. These practices, simple practices like deep breathing, meditation, prayer, humming, even singing, spending time in nature, and gratitude exercises, these habits can significantly influence long-term health outcomes, just like exercise, what Peggy had mentioned. Remember these things because this is something else you can do at home or when you're in the car. I sing in the car, or I pray, or I hum, or I do something. You can help yourselves, and that's where healthcare begins, is with yourself.
And
So,
part of the whole relaxing and learning how not to
mhm,
react to everything, um, it's not a book that I in any way know the author or anything else, but there is a book that I was introduced to recently. It's by Mel Robbins, The Let Them Philosophy.
hmm,
Title is, it's a big green book on Amazon, not very expensive. Mel Robbins is the author. And basically, tells you, like, you're upset about the traffic. Well, let them. I'm not going to be upset just because I'm here too. uh the kids are acting out. Well, let them, as long as it's not unsafe. That's a little fun.
yeah,
And it's made such a difference in a short time, because you end up laughing. You say, okay. I was stuck
yeah,
on the bridge between two states today, and 8 lanes of traffic trying to go on one lane to the bridge back to PA, and I could be miserable and I'm going to be late and get all upset about it. And I said, well, let them, I'll get there eventually, as long as I'm safe. And it changes your outlook. If you can kind of remember those two words, let them, and not get excited about every little thing. Um, it's
it's
another
like
way of
saying,
controlling stress. Um, and if you don't read much, you can get it on Audible or Kindles, it's whatever devices that you connect to. I'm sure I haven't even looked on YouTube. I'm sure there's a lot of things on that philosophy available there. But, the important thing is to know when there's something that absolutely must be addressed. And in between doctor's appointments, since they seem to be further and further apart, keep an agenda for when you get there, and so you can actually be aware, because you're not going to remember. Maybe you woke up with a terrible headache, and turns out it was only something you ate, but you didn't realize that at the time. If you see a pattern, and the urgent care type facilities that are out there, they are replacing, or trying to at least fill in the gap for many people that don't have primary doctors.
yeah,
So, and it used to be you'd never see, very rarely, an ambulance outside urgent care. Well, because of the lack of, hospitals closing and everything. But they're trained to actually know a real emergency and get you to the hospital in time when you need it. We just have another minute here. So, Gloria, what would you like to say to
I
just
would like to
remind?
say, choose your battles wisely. We've heard it a million times in our lives. Well, choose your stresses wisely because the rest is just static. you know, it's just static. Let it go. It's just going to happen either way. So you can deal with it
That's true.
later.
If they want to be, just let them. Just remember those two words. And thank you for joining us this week. Um, Please, like and share this with people. I don't know anybody that couldn't benefit from, controlling stress, and, having a healthier lifestyle, the things that don't
It's a
cost a lot
commercial
of money
break.
to
Yeah.
control. So,
We got
um,
a third commercial break now waiting.
okay, and then we'll finalize everything. Thank you.
Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals. Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant, like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Welcome back to our final segment of The Holistic Nurse with Peggy Smith, and Dr. Gloria Warren has been talking about holistic healthcare, holistic nursing. Do you have any, final closing things you'd like to share? Warnings or hope?
Nobody really knows where the future of healthcare is going, especially for nursing, but you can predict some of it, like artificial intelligence reviewing AI generated patient risk alerts, like Peggy had mentioned, identifying early signs of sepsis, monitoring abnormal lab values, very common even now, assisting clinical documentation, already happening, prioritizing patient needs in the process thereof, supporting medication safety checks, not quite there yet, but I'm hoping we see more soon. A hospital nurse receives AI information or alerts indicating that a patient's vital signs and values, which may suggest early sepsis. The nurse immediately assesses the patient and notifies the healthcare team, allowing treatment to begin immediately. So those are things. Wearable technology, remote monitoring, virtual care platforms, personalized medicine, predictive health analytics, health and expanding roles. Nurses are increasingly becoming wellness coaches, and this is where holistic comes in, because they need to be wellness coaches, community health leaders, preventative specialists, healthcare educators, like that person that wasn't even told how to take insulin. I mean, come on. I hope that nurses today will actually sit down with people and do this. But obviously there are still, it's like Swiss cheese sometimes out there. Technology facilitators, like how do you get onto your thing? Okay, well, here we printed this out for you, follow it step by step, something. While healthcare, the technology continues to advance, the core principles of nursing remain unchanged. Patients will always need compassion, human connection, education, advocacy. We talked about that last time, and trust. The nurse of future may have access to extraordinary, but healing will still begin with caring. Most successful healthcare systems will be those that combine innovation and humanity, science and compassion, along with the technology with holistic care. So,
And I think too, people don't realize, I mean, if you're getting discharged from a facility and they're talking really fast because they know they have 8 more patients to do in a half hour, it's okay if you say, whoa, slow down, or, I'm a visual learner.
That? Yeah.
Repeat this, because you could end up at home like this other family. And, now what do? We have all these meds. We were never on these meds. And
Uh-huh.
even things like the genealogy, the ancestry type websites. Everybody wants to find out where they came from and all that, but also information about gene research that's in your family tree. You should know what your possibilities are, so not so that you can worry about when am I going to get this, grandma died of this, but because there's a lot of things you can do. Just because it runs in your family doesn't mean that you're going to have the same outcome that 3 generations ago did. uh,
Yeah.
this is all about having healthy, high quality life. And bottom line is, it's up to you to fight for that for yourself. And you shouldn't have to fight, but we do. But it's worth it. I mean, nobody else is going to fight for you like you will. Um,
And-
but always, if you're confused with a practitioner, they don't realize how fast they're talking sometimes. So make sure you say, you know, please slow down, or I'm not sure I understood what you meant here. Do we do this 3 times a day, or once a day, or once a week? What is it you want from me? Um,
Right.
and a lot of times you feel like nobody's even going to see all those records you're keeping for the doctor, but you're seeing them, and they do want to at least. They're impressed actually when you go to the doctor.
Sustainability.
You save them a lot of time if you can show them the patterns that you experience at home. If anybody has any questions, I do answer questions on the YouTube channel. It's at the Holistic Nurse with Peggy Smith. We're here every Saturday at 1 p.m. And Gloria, when is your show? Would you like to share that?
My show is on Wednesdays at 2 p.m. Eastern. So that is the Medical Intuitive Insights with Dr. Gloria Warren.
And this is I'm the holistic personal practitioner, but this is an example of how science can come together with with people and be human and improve outcomes. And that's what our goal is, to live longer, healthier lives.
Hmm.
Is Nothing's easy in life, but as complete as we can. And if you have deficits, you doesn't mean you can't have a complete life. There are ways of handling them. But thank you very much for joining me, Gloria, and the
Thank you to
rest of
all
you.
the holistic nurses out there.
Oh, well, thank you.
Mind,
Um,
body, emotions, relationship, environment, spirit. Love it. Keep doing what you do.
Thank you very much. I hope your mother is benefiting from that and she's doing well. And we will see you. I'll see you next Saturday, the same time. And Gloria will be here on the air on Wednesdays at 2 p.m. Eastern Time. Thank you, everybody, for joining us today. Have a great week.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Here's Saturdays, 1 p.m. Eastern.